back to another episode of Malachi's Message, Toxic Mold Sucks. This is stories and expert episodes mixed together today. I am Elizabeth Kripe, Executive Director and co-founder of Malachi's Message. Co-hosting today is Emily Rochelle. She is the board chair and co-founder of Malachi's Message. Today we have just the really, really amazing privilege of speaking with Dr. Hailey Eddington. She is a board-certified naturopathic doctor, and if you know her, she's incredibly passionate. She is a huge advocate for her son, which I'm sure we'll hear about today, and she cares genuinely about the people that she is working with. Hailey, thank you so much for coming on and talking to us today.
Thank you for having me. First podcast ever.
Woohoo!
Yes. So
Hailey, you and I, we know each other from like the past. You were the one that actually really helped me help my son. So I'm just so honored. And I think it's such a privilege for people to be able to hear you talk and have you educate them on everything that you know. So with that said, why don't we just dive in and tell us about mental health and, the connection to mold and mycotoxins.
Well, thank you so much for having me. And in terms of mental health, I wanted to kind of talk about how the parent goes through a mental health trauma when it affects their children, because all you want to do as a parent is to, number one, keep your kids healthy. You want your choices to not affect them. And when you move into a mold home, you have this overwhelming guilt, beyond mom guilt, that comes naturally as a mom, where you think, I exposed my child to this by a choice that I made, and now they're suffering the health effects of this choice, and I could have chose different. And I definitely had that experience with my son, and I'm sure you did too. We're the adults and they look for us for protection. And it's, people need to understand that they're not alone in that feeling. And sometimes those things happen to you because you were wronged, because you were placed or sold or someone rented a home to you that you had no way of knowing what was behind the walls, luring and ready to attack your family. And I do think that counseling for parents in that aspect is really important to deal with that guilt. It can be really debilitating when it comes to the full healing of your family. I, as a naturopath, your emotional state is huge when it comes to healing. And if you get out of a mold environment and you're carrying that guilt of what your children are experiencing or a loved one, it can hinder your ability to heal the body after you've been exposed to the mycotoxins.
Is that something that you would say it can be long lasting? I mean, it's really ironic you brought this up, right? We just discussed the topics today. I was walking my dog this morning and I literally started to feel those things, thinking about some testing my daughter. We're 6 years out of mold that my daughter's going to have to go through. And those feelings out of nowhere started to come up again. Like, man, if I had been more intentional about knowing the area we were moving to, if we had been more intentional about getting testing done, if we had been more intentional about these things, and I'm 6 years out. So is that something that you see at different levels in people you've worked with or in yourself?
I think that it is something that you will carry long term. I mean, especially as a woman, I feel like we're naturally more emotional in that regard, and we feel this exceptional responsibility over our children. Not that dads don't, it's just as women, we're so much more emotional about it. And, we've already got the mom guilt. And then you're just like, I think what it causes for people who have had that experience is it makes you more vigilant in every aspect of your life. But that can also be a negative thing, because then you're like paranoid, like reading every label, not living your life because you're just so freaking out. I mean, I've had patients that I want to meet them for the first time in person, and they won't go meet me at a restaurant because they don't trust that the environment isn't going to make them sick. They're so mentally just traumatized with poor choices and where they place themselves and how it's affected their health. And so I think that is long lasting for some people. It's actually debilitating. People don't want to go out in public. They don't want to socialize. They don't want to go to their friend's house because they're like, well, what if they have mold? This could trigger a whole mast cell activation all over again. And they just don't want to go. And so I do think it's long term, especially for women. And I've seen men have like borderline like bipolar disorder develop from what it's done to their brain, because it messes with all of your the biochemical things that happen in your body. All the mycotoxins attack all your systems. So your dopamine, serotonin is messed up. You've got all these chemical imbalances from mycotoxins. And until you properly detox them and really focus on your mental health and getting that guilt kind of tucked back away and not having to make that hinder your detox process, your ability to heal, or your confidence that you can heal, I think that's huge.
I think one thing that kind of comes along with the mental health and the guilt is when the person who's responsible for putting you in that home, who didn't disclose the information about what was in that home, isn't held accountable. And then when you leave and you see that they just move somebody else right in, you know, they're not being held accountable, and now they're subjecting somebody else to it. And then your hands are usually bound as well, because attorneys will tell you, well, don't go, you know, if you say something, and then they can go after you for slander or defamation, and it's terrible.
Yeah, I mean, I won't lie. I had dreamed about a burning the house down situation so that no one would ever have to go through what I did, but that's illegal. So I was just praying that nobody will be put back in the home that we experienced, but the homeowner turned around and put it right back on the market. And he has his own children. And I even said, you know, you have 2 4-year-old little twin girls. Would you put them in here knowing what you know now? And he said, no. And I was like, then why would you put another innocent family in here? And he didn't have an answer. And so it's just like, it's very wrong, the lack of accountability to the other party. So you end up carrying all the guilt, because at the end of the day, you're responsible for your children or your loved one, and you're responsible for their protection, and they look to you and they're dependent on you. And I had the same feelings of guilt with my son's vaccine injury. And so it kind of snowballed. It was like that guilt just kept compiling, because I'm like, here we go again. I did it to you again. Like, I wasn't supposed to subject you to these things. Like, deep down, I always have that concern. Is he going to get worse from this? Is he going to get worse from that? Well, mold was not something that I even saw coming. Mold was not in the back of my mind. I was more worried about, don't eat a lot of rice. It has arsenic. Don't take a bunch of food dyes in. It spikes your ADD, you know, like things like that. I wasn't thinking my home, my sanctuary, my peaceful place was going to be one of the biggest detrimental health effects of my child. So, I mean, sometimes it's like you have to remind yourself that even though you feel this guilt, you really didn't have control over the situation and what happened to you. I think that's the most important thing to realize. And it's a very hard thing to accept.
Can you, since you touched on that topic about your son and when y'all moved into this home, because earlier you explained that you're trying to, you know, do everything you can to not really recognize that it could be possibly mold. You're getting tested from all these other doctors. But what did you see? Like, how did the mold regress your health or your son's health when you moved in? And what is the connection between mold and neurological symptoms and regression and so forth?
So my son had been detoxing for, I want to say 4 years, around 4 years, since his vaccine injury. And we had paid for stem cell therapies and things that showed immense improvement. He was really making huge leaps and bounds of losing his ATEC score, which is an autism checklist. Like, it was slowly creeping down, and I was just like, oh my gosh, like, this stuff is working. He's finally like getting this junk out of his body. And he was at an amazing place where he was borderline conversational with me at this point. When his original vaccine injury happened, he was completely nonverbal, wouldn't look you in the eye, wouldn't answer to his name. You could scream at him and he wouldn't turn around. Not like mean, just like yelling his name right behind him with his back to you, and he wouldn't acknowledge you, to the point that he was now interacting with me in speech, looking me in the eye, being social, all that stuff. And I moved into this mold home, and in only 3 months, my son regressed probably 3 years worth of progress that I had worked my rear end off to achieve with him. He turned literally gray in color. His skin was gray. His cheeks sunk in. He would hold his head and scream on and off. Just, he would be completely happy and then just start screaming in pain because his brain was on fire. He had these acute brain inflammation scenarios where it would just hit you out of nowhere and you're just like, oh my gosh, what's going on with you? Like, why are you doing this? And I would think to myself, maybe he has a headache. Like, I don't know, maybe it's an ocular migraine that's just having these spikes. Like, I didn't know what it was. And I was just, it's like, you know, when you look at your hair every day in the mirror, you don't see it grow, right? You don't pay attention. You're not like, wow, my hair's in it, you know, longer today, because you see it over and over. And so it was a little harder for me to fully grasp how bad it had gotten in those 3 months until one day, he just stopped responding to any treatments I had been doing before that worked. He stopped eating anything but sugar. He was doing the screaming and holding his head even more. He was waking through the night. And there were so many neurological deficits after that where he just, like, he acted like he didn't know me. And I would ask him a question that he should know, like, what color is this? And I'd hold up a green marker and he'd just start bawling because he couldn't verbalize it to me all of a sudden. And that's something that he had mastered a long time ago. And I was like, and then I started bawling because I'm like, what is going on with you? Like, why is this happening? And then that's when I just started like flipping over every stone until I figured it out. But the problem is, once you get in that environment, the effects are so fast and they take very long to peel back. So it's like quick to hit you, and it is a marathon to detox it, because mycotoxins just keep on going in your system until you literally have to force them to stop with detox. And you have to detox for a while. And it's something where, you know, you can't think, oh, I'm out of mold, I want to feel better in 2 months, I'm going to make that happen. You can't hit mold hard. You have to take baby steps, because your body is so sensitive to everything at that point that it has to be a process. And like, I'm peeling back those layers. I like to refer to it like an onion: autism or mold toxicity. So
what detox, I know we talked a little bit about it before, but when you said that, a lot of people have that misunderstanding, right? They think if we're in mold or we just got out of mold, we just need to hit my body hard, we need to detox hard. And you're saying pretty much the opposite right now. So can you explain that a little bit more? Why?
So, well, whenever, like, your mast cell activation is at its all-time high when you come out of a mycotoxin environment or enriched environment. So your body is going to react to things that are supposed to be healthy for you. If it's too stimulating to the immune system, if it's too many things at one time, the body doesn't even know what to do with it because it's in such an inflamed state. So the goal initially needs to be binding up as many mycotoxins as possible, or suppressing the ability for them to continue to replicate in the body. And at that point, it's also a systemic issue. So a lot of people think, oh, it's just in my gut, it's like candida. It's not. It's systemic. It's in your bloodstream. It's affecting all your organs. It's affecting your brain. And at the end of the day, one of the hardest things to ultimately detox is the brain from mycotoxins. And there are ways to do it. It's just like, you have to just start with baby steps. Like for my son, I got him in an environment where we brought nothing with us. We had 3 air mattresses in this home. And I slowly bought new furniture over time. I was like, let's get a chair today. Let's get a couch. You don't have to eat on the countertop anymore, because now we have a table. Like, it was one of those things. But I was so determined to never experience that again that I just was like, get rid of all of it. And what I started with him was binders. Truly, I didn't give him vitamins. All the things that he previously took, never gave it to him. I stuck with one really good binding agent, and I dosed it 4 times a day for about a month. And I slowly started to see his color come back and his cheeks fill in. And then I added in sublingual T-cell immunotherapy to boost his T-cell production, to help combat the mycotoxins in his body, fight for him on his behalf. And so it's like, you have to take the baby step approach. You can't just hit it like a train and be like, these all say they'll work on this website for mold, and I'm just going to take everything, because 9 times out of 10, the body's too sensitive and your immune system will crash. Your body will break down because it's too inflamed to handle all those things. So yeah, it's done in phases to detox.
Emily, Hailey's protocol for Sebastian really helped, right? That was one of the game changers for you guys.
Yeah, Hailey educated me on detoxification, baby steps, also important things in the body that need to be increased, that can be decreased whenever you're exposed to molds such as macrophages. I mean, she educated me so much that I was able to then go take what she gave me, look into it, and then start applying it to Sebastian.
Yep. And so macrophages also work synergistically with T cells. So I use both modalities, macrophage activation and T cell immunotherapy, because if you are supporting those two things that you naturally have in your body that mycotoxins have suppressed, it actually has shown to really improve people's ability to their bodies to heal themselves. And in a Western medicine society, unfortunately, you know, they're in their mentality is kill mode. They see something, well, I got to kill it off. It's like, but you can't approach mycotoxins this way. You need to support your own body's natural abilities to detox. Even if they've been hindered, you can repair it. And with Sebastian, you know, you had already been didn't you spend like 2 years or 3 years already kind of getting nutrients back in his body and
about
seeing someone about that?
I think it was about 1.5 years, and then I met you, and then
and so
everything changed after I got.
And he was a candidate for immunotherapy because you had already done that footwork. Like you let his body take a break and you were getting it healthy. And at that point, it's like, yes, you are a great candidate for these immune modulators because it's not too much for him. But some people, when they get right out of mold, I'm not like jumping on the train, like, here's all this stuff, because I don't want to overwhelm their body systems. But when they've been out of it for a little bit and we've done some other supports, then I'm like, okay, now I want your immune system to do a lot of the heavy lifting for you. And in Sebastian's case, like when you told me the stuff that you'd already done, I was like, oh, he's a perfect candidate for this. And you felt like you were plateauing with him, and it just like helped get him around that corner, you know?
Yeah, it was night and day after I started doing some of the things that you told me to do with him. I want to say he was saying 2 words, but nobody could understand the 2 words because they weren't, it was kind of like a grunt, but I knew what he was saying. And then like within, I say 3 weeks, 4 weeks, he was saying a 2-word sentences. And then after that, it was a 3-word sentence. And then we were going to 4. And everything. And that's because of what you told me to do. That's what changed everything.
I'm so glad that he responded like that. That's like an amazing story. I love those kinds of stories. And it's, you know, I want that for every child. Like I want them to experience that. And, you know, sometimes I think one of my biggest hurdles too is you were just so, you were so willing and ready to do whatever you had to do for him. And you fought for his life. And there are some parents that all parents want to fight for their children that I come across, but a lot of my patients either come one or 2 ways. They're so eager that they're impatient and they're like, just give me what I need. Just do it. And I'm like, yes, but I'm keep trying to explain, like, it's a process. Like, I'm not going to hit your body with a billion things at one time because that's setting you up for failure. I don't want that for you. I want you to have a success story. I want you to heal properly. And I don't want to be the reason that you don't because you want to rush the process. So you either get someone like that or you get, you know, a parent or a patient that's like, you know, whatever process we need to do, I just want to make sure that it's done right and it's done successfully. And you were one of those people. And I could just tell that about you because you were like, I want to fix my kid and I'm going to do whatever you tell me to. And I was like, this is perfect. So these are the things you want to do. And so it's kind of hard sometimes for me because I understand the panic. I've been in mold. My family suffered, and you do have a sense of panic. Sorry, I got a call and my phone's hooked up to my computer somehow. You do feel a sense of panic though, because, you know, the guilt that you feel for exposing your family to it, And then you want to correct the problem. You're like, I've got to fix this. I caused this. And you get panicky and, or you're tired of feeling like crap every day and you're tired of not being able to function or be around family. And you just don't feel like you want to be here. You just are like, I'm miserable. My body hurts. I'm not the way I should be. And they get impatient and sometimes angry. And you're like, I totally get it because it affected me too. I don't really touch on that subject, but I developed POTS symptoms from mold. So I was getting up from sitting down and passing out. It's a orthostatic blood pressure issue. And so when I would go from one position and my blood volume would shift too quickly, it would cause me to faint. And that was happening to me towards the end. And I was like you, I was like, I don't care about me. I want to fix my kid. And so I just hyper focused on him to get us out. I pushed through everything, but I totally get the desperation that people feel to get better.
Whenever last month we were focusing on mold and the link to autism and stuff.
Yeah.
We need to take a quick minute to thank one of our corporate sponsors. One of our corporate sponsors is the law office of Kurt W. Carpenter. That he has a law firm in the Woodlands, Texas. The law office of Kurt Carpenter helps property owners, business owners, and entrepreneurs in Montgomery County and the Houston area who are in need of legal assistance. Attorney Kurt Carpenter focuses on property litigation, including construction, business, and real estate law. Their office understands the legal issues facing property owners, business owners, and entrepreneurs in Houston because they also invest heavily in the market. If you need to speak to an attorney who has business owner and investor experience, then give them a call for a consultation. They also work with nonprofits.
Last month, we were touching on the whole subject of, mold and its link to autism, because now there's published studies showing that mold could be a cause to having a child regress into autism. Can you kind of touch on that a little bit? And then on also the subject about if a kid's not responding, that it could be because of the environment.
Yeah. So I'll be completely honest. I haven't read all the studies. You might have read more studies about that than I have, but I already went off of knowing the fact that it does cause this. But one of the biggest things with the regression into autism, again, is a lot of people don't put two and two together. Like they might move into a home like, oh, we're going to move into this nice home with this big backyard and this play set, and it's going to be great. Our kid's doing so well. He's making progress. And then you move into this environment and you're like, what the heck? He's not doing what he was doing at the last house. But they never actually sit there and finally make that connect of like, the only common denominator there was that you changed homes. And then they don't think to look at their environment. And it's really unfortunate because the same thing happens for kids who aren't even vaccinated at all, that are brought home from the hospital into a really mycotoxin enriched environment, and they never respond to any detox or any treatment because from birth they've been brought back to a toxic environment, and it was just a compiling effect, and their toxin bucket kept overflowing to the point that it's not controllable anymore unless you get out of it. And a lot of parents, I talk to them and they're like, my kids never responded to any intervention and we've tried everything. We've spent, $50,000 on over the years on these things, or we've taken out second and third mortgages on our homes to pay for our kid to get better, and he's not getting better. And I'll always say, well, when did you how long has your son lived in this house? And a lot of times they'll say his whole life. And I'm like, have you ever checked the environment? Have you ever checked to see if you have a mycotoxin issue? And they're like, well, no, I would never have thought to do that. This is our home, And they kind of are like, what? Like, why would that be a factor? It can't be that hindering. And I'm like, you have no idea like how terrible it can be. So it's good though, because people need to know that if your kid is not a responder, if you are detoxing a child on the spectrum or with PANDAS and they just plateau and they're just not making progress, or they're not responding at all, or they've regressed, always check your environment. It is so important. And I'm not talking about any guy you pull up in the phone book to do a mold test on your home. You need to run an ERMI. You need to find someone who's actually like genuinely involved and concerned, like Emily and Josh, that, you know, want to make sure that a family is safe, that have actually had that personal. I think the fact that you had your personal traumas from that obviously put you on this path. It made you want to make a difference. And those are the kind of people that you need checking your home. So I think that's huge. And another thing too that I wanted to mention is I wanted to touch on, if you're okay with it, some of the things that people can just know they can do coming out of mold. So say you find out my house is toxic, my rental's toxic, and you know, what is the first step? First step is don't take anything porous with you. No furniture, no bedding, no loveys, no stuffed animals, no blankets, no clothes. All of those things are going to carry mycotoxins into your new environment. No mattresses, things that, as Josh and Emily told me, because she taught me this stuff about what I can and can't take. But I think it was your husband or you that told me, if you can throw it in a pool and it can absorb water, don't take it with you.
That's Josh.
Yes. And so I was like, okay, so basically my pots and pans and my Tupperware is all I can take with me. And so it's a hard thing to tell people because not everybody has the financial means to just abandon everything they own. And so I think that's really important about the work that you guys are doing, is you're providing that aid to families in these situations and getting out of this, you know, horrible environment that they feel trapped in. So that would be the first thing, you know, that's the definition of learning that things are just things. Like when you're in that kind of a situation, you're like, you look at life a lot differently because everything in that house is replaceable, but your loved one isn't. And so that would be the first thing. And then, you know, when you enter a new environment, it's really important that you also test that environment. Make sure that you're not doing it 2 times over and being exposed again, because nobody wants to go through this twice, let alone the first time. And then the other thing would be start with a low oxalate, low histamine diet. You can find those on the internet. It tells you what foods to avoid, but it will lower the inflammation in the body to calm it down so that you can be more in a position to detox. So that's a really important thing. And then some people read on the internet, jump in the sauna, do a detox bath with Epsom salt, all this stuff. And that's not necessarily the best choice for people. It can actually activate inflammation for some or redistribute toxins. And so I think we talked about that before we started the interview. So that's really important. And then another thing that I wanted to bring up is also hyperbaric oxygen therapy is very beneficial in treating mycotoxin exposure. There are studies about it, and it does it eliminates the growth of mycotoxins, and it helps aid in elimination. So those are the things that I wanted to point out. I mean, I can't give across the board advice, obviously, but these are good starting points for people to consider when they're getting out of mold.
Can you, so the sauna, the infrared sauna, that was something that I've heard a lot too, right? And until we talked earlier today and you explained it a little bit, I went, oh, that's incredibly logical, why that would not make sense for everybody right away. Can you explain a little bit of the science behind why you're stating that fact, just so people can hear it?
Yeah. So with the sauna, like if you're getting on the internet and you Google like detox mycotoxins or detoxing mold or recovering from mold, and one of the first things you're going to see them advocate for is getting in a sauna, whether it's far infrared, near infrared, whatever, a sauna. And the problem with that is due to the state of the inflammation in the body, not everybody their detox pathways are not necessarily open. So if you're getting in a sauna and you're not sweating appropriately, all you're doing is redistributing toxins into different parts of your body because you're not actually detoxing in there. And it can actually trigger even more inflammation if your detox pathways are not open.
Go for it.
That makes perfect sense because I've known people, and you tell me, Hailey, But that does make perfect sense, because I've had people that have literally been rushed to the ER because when they get out, they try to do so much so quick that it just is like a Herxmeyer reaction, and it's, they're down. I've also heard that with HBOT though. Is there a time frame when you should go into HBOT and when
that's a very individualized question, I would say, because it really depends on where someone's at. Are they fresh out of mold? Have they stabilized? I think that you need to be, personally for me, my son did hyperbaric oxygen therapy and responded very well to it prior to mold. And it certainly helped him recover from mold. That was the third modality I employed after binders and sublingual T-cell therapy. And then I employed once a day chamber dives for 90 minutes. But I didn't do it until I felt like he could handle it, because it is a form of detox. It's going to help with the inflammation of the body, but not every one person is the same. So it's really important to take into account where they're at in their journey with that exposure and where they're at, health wise, what they can handle, because you have kids that they can handle a dollop of a transdermal cream that is for detox. Then there's kids that can only handle about the size of the top of a pin, like a tap of a pin, like on the bottom of their feet. It's crazy. So it just depends on the person if they're sensitive.
What process did you go through? So you went through molds, you already had medical background, right? So you worked hard to make sure you can help people. What process did you go through to make sure you're at the point you're at now? Because I think it's inspiring, honestly. You're a mom and you've done all this. I think it is so inspiring, and I think people should hear about that, to hear that you care. It's like, in my mind, that shows you genuinely care.
I'll try to summarize it as much as possible. It's like a 7-year thing, so it's like a lot. But I worked in NICU and PICU in Western medicine. I did life flight, ground transport. I loved my job. Didn't have kids at the time. Then I fell pregnant with my first son, and I was working. I worked until I was like 38 weeks. And the only reason why I didn't go to work that day and took my maternity leave was because not even Crocs would fit on my feet. They were so swollen. And so I was like, okay, well, I didn't realize that was the last day that I would set foot in a Western medicine hospital, because my son started having reactions to vaccinations starting at 2 months old. And it started with gut and skin issues. Then it snowballed into reflux, silent reflux, reoccurrent ear infections. And so I was unable to return to work. And it was just such a nightmare. It was really hard to truly enjoy your child when they're screaming in pain or having an issue every 2 seconds. So I stepped away from my career, and I was there for my son. And at the time, I did not put 2 and 2 together myself, because I was very brainwashed into one way of medicine. And I believed that I was doing what I was supposed to. And for every issue he had, they're like, oh, well, just do this. Give him this then. Give him this antibiotic. Give him this prescription for reflux. Stop breastfeeding him because it's your fault. These types of things were being thrown at me. And I was just like, okay. And then I started to go, something's not right here, because he just kept getting worse. And then one day he went in for his DTaP at 9 months, and he screamed bloody murder for hours and hours and days and days. And before I knew it, it had almost been 2 weeks of inconsolable screaming, because essentially his brain was on fire. It triggered something that nothing would calm it. The only thing that calmed him down was pushing him in a cozy coupe car, the little red and yellow toy car the kids can get in. That was the only thing that made him fall asleep with this pain. And then I fast forward 4 months later, I made the mistake of going back. I was bullied, and they said, you need to come back in. He hasn't had his MMR. And I was like, oh my gosh, like last time we were in, this happened. Like, I still didn't listen to my intuition, which I feel like mothers need to do. If something is telling you not to do it, no matter how bullied you are, listen to your gut, because I didn't. And I went back in, got his MMR. He formed a welt on the injection site on his leg. It was hot to the touch. His body was literally rejecting it. And that was kind of the thing that shoved him off the cliff into that autism spectrum diagnosis criteria. And so then, I started doing research, and it started with ABA therapy and speech therapy, because all the doctors were like, oh, well, this is how we deal with that. These are your only options. And I was like, I believe in like science. So this was induced through science. So there should be a fix in science to what just happened to my son. There should be a means of me understanding what happened inside his body to cause this, because when he was born, he was perfect. But then ever since someone else touched him, some other medical person, he just got worse and worse. And I was like, this isn't right. And so I started doing my research, and believe it or not, before I knew it, I was reading 6 hours a day of medical journals and white papers and all kinds of things, and getting really involved in just cross-referencing all these different medical issues, trying to go, okay, this sounds like my son's symptoms. Like maybe it's affecting this biochemical thing in his body. And so then I would start implementing supplements and detox protocols that I started to create for him. And then I started a biomedical Facebook page with a couple other moms, and we would share these protocols just for free. We're like, this helped our child. Like, if you want to try it, this is not medical advice, but this is what we did, and it worked. And so then the group just grew and grew. I want to say it had over 10,000 members at some point. And then I stepped back from that, and I became a certified holistic medicine practitioner. So, and I swore I'd never go back to school. And then from there, I did that while we were in Colorado, and he was detoxing mold, because I realized I spend hours a day, advising or helping people, and I just need to make this my career. So then we moved back to Texas from Colorado, and I was like, I need to be a doctor. So to be like credible, I want people to trust me. I want them to know that I'm not just spewing information, that I am legitimately board certified, and that I have done the hard work to help you, and I care to do this because I want to help you. And bottom line is, I had the experience of going to endless functional medicine doctors, and a lot of them had cookie cutter approaches. They didn't look at my son and go, let's look at his genes. Let's see if he can handle this supplement. They just said, well, this is what we give these patients on the spectrum that have this. And they had tons of patients, but I was like, I don't want you to give me what you give everyone else. I want you to give me what my son needs. So I decided as a naturopath that my ultimate thing was, that's like when Emily has asked me some questions, I'm like, it depends on the individual. Like, I can't say straight across the board, this is going to work for you, or that's going to hinder you, or it isn't, because I truly made it my new life mission to treat everybody as an individual and not like a number on a chart. And that is why I care so much, because I spent well over $100,000 chasing my tail, hearing, well, this doctor helped me. Well, this doctor helped me. And I would send my son there, and then he was worse. So I had to take it into my own hands. And so I feel for the parents that have been in the trenches, and they're just so desperate, but they keep funneling money into people that have these cookie cutter approaches. And so I want to be different than that. And I want to show up for parents the way that no one else has.
I see that a lot, 6 years into the mold industry, and, keeping up with our clients, and a lot of our clients go to the same doctors, and then some get better because that protocol, which is the same pretty much for everyone, works for some, but then others, they're still spending thousands and thousands of dollars, but they're not progressing. They're not getting better because they're not changing anything, for that person, because they were affected differently, or their genes are different, and so forth. And which is one of the things that I just love so much about you, because you actually individualize it versus give everybody else the same protocol as everybody else.
That's one of the first things that I ask. I don't force anyone to do it, but I highly encourage that they get a genetic panel and a food sensitivity panel, because that basically sets my yellow brick road on how to approach you as an individual. I have to consider everything about you personally. I can't just go, well, this protocol helped this person. It's like, I do have things that I do that are safe for the most part that I kind of throw into a full protocol, but the overall individual care that I give, I really highly recommend that they understand their own body and why they can't tolerate things that maybe worked for their friend. And that way I can educate them even on the fact that, well, you have this genetic mutation, so your body can't process this mineral or this vitamin appropriately. So you need this form. And they're like, oh, you know, like that. They're just so surprised. They're like, that's a thing. And I'm like, yeah, and that's your body. So we need to make this about you, not your friend. I'm glad your friend responded, but this is about you. Let's get you better. And so I just wish that someone had that approach with me and my son, but I realized I just had to become it. So that's the best choice.
So where can people find you? Are you only seeing patients in Texas?
No, I have patients in other states. I
Okay.
do telemedicine only. So I don't trust the lovely current administration to have a brick and mortar location at this time. So I do all telemedicine. I don't take insurance for obvious reasons because that limits what I'm allowed to do. But yeah, I have an email, which I can provide and you guys can include it on my intro. But I just have people email me and request an appointment, and then I get them on the schedule as quickly as possible.
Hailey, thank you so much for coming on and sharing all of the information you've already shared. There's so much more that we want you to share, so we're going to have you back on.
Love that.
You know, sooner than later, so you can share more because you're just a wealth of knowledge. And thank you again for taking the time to share what you shared today.
Absolutely. Thank you guys so much for having me. This is my first podcast. So it's exciting for me. I feel like I've conquered something today. But thank you guys so much for having me on. I would love to do it again.